spoke up, maybe, oh, since Hannah spoke up, maybe this is a good time. I'm not exactly new, but I'm Mandy Pratt Chapman. And on the project that I'm working on with Hannah, Marquita, is it okay to just ask folks about the patients that I mentioned? We're looking for.
Well, yeah, sure. Yep.
Okay.
Go ahead.
We're looking for patients that speak Spanish or Amharic to assess kind of social needs after being diagnosed with cancer. And we've had a little bit of trouble recruiting. So if you know of any folks that have recently finished treatment and might want to do an interview, they'll get a $50 gift card for participating, but we're really trying to map out where some of the gaps are so that we can try to connect the dots better. So
Sure. Thank you, Mandy, and thank you, Dr. Hannah. We're definitely open to others that are not navigators being a part of this group, and that's one of the goals for the future, to expand it, because we know that from a systems level, it takes more than just navigators to make a difference and a change. So you are definitely welcome on this call anytime. Anyone else would like to join to do a brief introduction?
Good morning. My name is Ana Alvarez. I also attended the last meeting, but I'm kind of new. I'm a cancer navigator at Mary Center.
Welcome so much. Welcome. Okay. Well, on that note, I am going to just shift focus a little bit to talk about some of the patient navigation success stories. Let me just say one thought. What Dr. Mandy Chapman just spoke about, I'll be sure to put that in our meeting notes so that if there are some clients that fit that criteria, you can feel free to refer them directly to her to take advantage of those, that research opportunity. And so going back to what I just mentioned, I'd like to now open up the floor for anyone to share about any patient navigation success stories that they've had. I know we've been in this pandemic, it seems like forever, but I think it's great that we just kind of hear from each other about the good things that have come about. Sometimes we spend a lot of time just focusing on like the challenges, but I'd like to hear if there are any patient navigation success stories. And also during this time, if you have any best practices that you've used since in the last 6 months since we last met, please feel free to share.
So again, I'm not a navigator, but I have good news. We just got a new cancer center director, and she seems very invested in navigation, and we're going to be hiring 7 new navigators. So I'm super excited to see an institutional commitment from GW kind of at long last. So I'm very excited about that.
That's great.
I'll share. So the Capital Breast Care Center, we focus primarily on breast cancer screening. And throughout the pandemic, we have, as all of you, been affected by the effects of COVID and, just trying to get people back to adhering to screening. So our numbers had been affected. And we partnered with AmeriHealth, an insurance company, to get their non-adherent patients scheduled for breast cancer screening. So each month, AmeriHealth sends us a list of 40 to 60 patients who have been non-adherent for the last year or two. And then we at the Capital Breast Care Center contact those patients to get them in for screening. And that has been really successful. We do still have a number of patients.
That's great.
Yeah, it's really great. And it was just something that, we thought about as a program, and I think is really successful because, a lot of people who weren't getting screened before, they're now getting screened, and it's great. It's a great partnership. So that's something that I'm really proud of that we're doing here at the Capital Breast Care Center.
That is absolutely amazing. And that kind of like, that's kind of in line with the thought that I have about reaching out to some of the MCOs. I know as someone who works with the federally qualified health centers, I want to do something similar to that, where they're able to have some community partnerships to around like mammogram vans and different things like that. And I know that there was a time in the past where the MCOs, we're talking about the Medicaids and the various ones, would give patients gift cards for preventive health screenings. And so that is definitely something that the PCA will be looking at in the future to see how we can better work with the MCOs to ensure that. I'm glad that there's talk around that.
Thank you.
Marquita, it's Julia Rowland from Smith Center for Healing in the Arts. Just wanted to share some stay tuned information. Some of you may know that with the Biden Cancer Initiative, one of the things they did before that was sort of shut down, which may also reopen, is they created a professional oncology navigation task force. And that task force continued beyond the initiative, and they will coming out this March in the Journal of Oncology Navigation and Survivorship. They're going to have proposed standards for professional practice in oncology navigation. So that should be out later this month. Stay tuned. When I see it published, I'll send it to Marquita, and probably she could circulate it. So that's going to be like our first set of standards nationally, which could be quite exciting. And then second, I wanted this group to be aware that Smith Center has historically offered integrative patient navigation training, where we train navigators to know about what are community services, where if you want to do nutrition or yoga or creativity as part of your healing process. We partnered with the Maryland University Integrative Health to put most of that training online. That will be an online 4-credit program that should be up and available by fall. So again, stay tuned for that, because it's another source of training. So thanks, Marquita, for the opportunity to share those resources coming soon.
Yes, please do.
Hi.
Oh, go ahead. Go ahead, Thelma.
Oh, hi. This is Thelma D. Jones with the Thelma D. Jones Breast Cancer Fund. And I wanted to announce our monthly support group meeting will be Wednesday, April the 20th at 6:30 p.m. Our guest speaker will be Cheryl Shaw, who is a 2-time breast cancer survivor and a popular realtor here in the region who's done extensive work in the field of breast health. And I'm also pleased to announce that at that meeting, Marquita, you have accepted the invitation to be a part of that meeting and to talk about the great work that you are doing at DCPA. So I welcome everyone to that meeting. Again, it's Wednesday, March 16th. Wednesday, March 20th at 6:30 p.m. via Zoom and Facebook Live. And I apologize that I'll go off camera because I have to do the meals and fresh produce for the seniors. But I will be listening.
You mean April, don't you? Not March.
Oh yeah, I'm sorry. April, yes, April the 20th. Thank you for that correction, because you'll be there.
Well, I would like to hear from some of the community health centers, and so I had an opportunity to talk to Ina offline, and I think she's going to share some of the things that a patient success story that she can that has happened recently or within the last 6 months.
Yeah, thank you, Marquita. Good morning, everyone. Oh yeah, I do have a lot of success stories. It depends where we can take it from. At Community of Hope, we do focus primarily on screening, having the patients screen for colorectal and breast cancer screening. So we basically refer patients out, help in scheduling, and any barriers that is needed in order for a patient to have the screening done. What I have noticed during the pandemic last year in 2021, I have a patient that was receiving a bill from Washington Hospital Center. She had her mammogram done there, and I think like for a period of 1 year, she's been receiving like a bill of $200 for her
Wow.
mammogram done there. And she was so frustrated and crying and anxious. She called the primary care clinic for the to ask for help because she was receiving $200 bill and she does not have this money to pay this bill. And she was very upset that she was not going to do her mammogram ever in her life because she cannot pay this. Which was very surprising. Patient had and always has been under Medicaid. So these things, small things that can happen at the hospitals and radiologies when the patient go, maybe, the insurance was not entered correctly in the system, or the billing department is not really understanding what happened. They just send the bill to the patient because that's what is their job to do. However, she was like more upset that the department of the billing at hospital center did not try at least to understand her and look into more details. So at that point, I've tried to look through my contact networks, and I sent a couple emails, and finally the account, it was balanced to zero, and it was like a mistake from the billing department, not entering the insurance correctly of the patient in the system. So the patient was very happy at the end, but the thing is, like, for 1 year, the patient was so anxious receiving that bill of $200 and really crying about it. And it's just, it's sad that, some, if we didn't intervene, in between and got this resolved, the patient will be like ending, having this in a collection, debt, or things like that, and more adding, and that will make the patient to not wanting to go to take care of their health anymore, just because of this, admin issue that happened at one of the hospitals where she went, which it shouldn't have happened that. And we were like more than happy to help. So these are like cases and patients when they need the navigators, and it's more important to have connection with the navigators and to have someone to speak for them. I have another success story that is about colonoscopy. We do have this great partnership with Washington Hospital Center colorectal surgery department. And patients, when they're scheduled for colonoscopy, that's the great thing that we have, that we always keep that connection and partnership with the hospital center, where the nurse navigator at the department keeps track on the patients, procedures, and consultations. And if the patient need anything prior to the procedure from the primary care side, that can be done very fast timeline. For example, like patient was scheduled for a procedure, and just 2 days before the nurse confirmed that the patient needs a drug test before the procedure. So we got that patient as soon as possible at the clinic, having done the drug test that it was necessary for the procedure that was scheduled within 2 days. We did schedule a transportation because we had this great funds from the MedStar Georgetown, and successfully, patient and happily, the patient had the colonoscopy done. So that's like great success stories that we have all the time that keeps us, continuing our program and focus on providing the services to our patients. And that what keeps me moving forward and helping the patients when I see that they are ending to do that procedure and having their screening done, whether to be delayed their appointment or having not doing the procedure at all. I can continue all day long. I have a lot of success stories, but I will give someone else to share some too.
No, that was really great, and that's the reason I wanted to, especially since we've had a bit of a break, come back and just kind of like hear what are those things that are happening that are successes, because I think it encourages us all to just keep on keeping on when we're able to hear these types of testimonies. So thank you so much, Ina, for sharing.
Yeah, there are these small barriers that always, the navigators, they always step into the patient to have the procedures and screenings, or the treatment done, such as like transportation, or if the navigator will not step in, a cancer navigator from the hospital or community health center or any other organization outside of the hospital treatment, it will be canceled appointment, the treatment will be delayed. So that's what, shows the importance of the navigation, and the relationship between the navigator and the patient, because they will always contact the navigator who they trust, and they build a trust relationship to get the help that is needed.
Yeah, and this just goes to show that, as navigators, we wear so many different hats. So thank you so much for sharing. At this point, I'm going to transition over to our first presentation for today. Kwani Drabo from Colorectal Cancer Alliance. He's going to just share with us some regional colorectal cancer screening resources. And let me just say, happy Colorectal Cancer Screening Awareness Month, everyone. I forgot to say that.
Thank you, Marquita. I'm getting ready to share my screen, everyone. And I'm very, very happy to see you back with us, Marquita. And I'm very, very happy to see everyone else back for our meeting. So let's get ready to get into this presentation, and happy Colorectal Cancer Awareness Month. Everyone see?
Yes.
All right, great. So my name is Kwani, and I am a community organizer for the Colorectal Cancer Alliance. What we're going to do today is briefly go through what the Colorectal Cancer Alliance is, mission, what our focus has been over the last year and a half. And at the very tail end, we'll drill down on what's been taking place in the District of Columbia. So the Colorectal Cancer Alliance obviously exists to end colorectal cancer within our lifetime. There's some very important CRC facts that I'm just going to go back over with everyone, such as 1 in 24 people get colorectal cancer, and patients that get screened early have a 90% chance of surviving if, like I said, if it's detected early. This is our mission once more. We are really focused in on providing support for patients, families, caregivers, and survivors, and also just trying to raise overall awareness, because obviously the more that people are aware of this form of cancer, the more inclined folks are to get the necessary screening done. And just for those who may not also be aware, as of May of last year, the U.S. Preventative Services Task Force dropped the national recommendation age for colorectal cancer screening from 50 down to 45. So That's some great news for everyone that's in the colorectal cancer space. We could definitely start seeing, hopefully, more and more individuals get screened earlier and earlier now. One of the things the Alliance has been focusing on as of late is really addressing the colorectal cancer disparities, especially within Black communities. As some of you may already know, that Black men are 24% higher to or 24% more likely to face this disease, and Black women are 19% more likely to face it. And unfortunately, the death rates associated with this disease for Black men and Black women is also considerably higher, whereas it's 47% for Black men and 34% for Black women. The Alliance takes a three-pillar approach to addressing the issue of colorectal cancer, and those pillars are screening. Does everyone hear me normally, or is there an echo going on?
We can hear
There
you.
was a slight
Oh.
echo, but it's fine now.
All right, great. All right. So we first and foremost, our most important pillar, in my opinion, is screening. We have developed a great screening quiz resource that's on our website, and it can be found at quiz.getscreened.org. We can give you a personalized and risk appropriate screening recommendation based on you answering a series of questions. We're also in the midst of utilizing some great awareness messaging that we've developed with the folks at the National Colorectal Cancer Roundtable for the Black community, and also those who are under the age of 45, which have unfortunately been seeing a 2% increase in colorectal cancer rates over the last almost 3 decades now. And also we have a outstanding Let's Get Checked partnership that's taking place, where we have access to north of 10,000 colorectal cancer screening fit kits, and we're working vigorously to get those out the door nationally, and we definitely want to get more of those out the door within the district. We also focus on care. We are very deeply involved with medical advocacy. We are really working hard at our peer and community support, whereas we are implementing buddy programs that really assist those who are unfortunately navigating this colorectal cancer space, but want to have someone that is much more familiar with their disease state and can connect with people that are either survivors or who are still going through treatment themselves, and listen, learn, and have someone that really can relate to them very closely as they venture along this journey. We also offer financial assistance through our Blue Hope Financial Fund, and we're getting ready to initiate another funding program in the near future. I can't say what it is just yet, but that rollout is supposed to take place next month. We also are focusing on closing the gap in patient advocacy voices via our diversity and inclusion volunteer task force. This task force recently created a Black outreach subcommittee for screening, and this subcommittee is comprised of folks from DC and other surrounding areas, and what they are currently doing is working towards finding more screening partners. Some of those potential screening partners include nursing associations and sororities, and local clinics, and local hospitals. So we're in the midst of looking for those and partnering with them and providing them with the resources that we have in-house that can get the screening rates up in various communities in the DC metropolitan region. And also we have a cure pillar, and the cure pillar is really focused on improving individual survival rates and the quality of life, as well as answering very important questions to young onset and disparity research. And we are really pushing more and more money towards addressing those issues that have been traditionally underfunded. And I think that, well, I don't think, I know that the Alliance has a couple more major announcements coming up later on this year as it concerns where else we will be placing our money as it concerns getting the necessary research done to address this disease. Now to drill down locally. Um, Within the DC region, not that long ago, DC Health Matters highlighted that there's a humongous difference in screening rates, especially within certain wards in DC. So, for instance, in wards in 3 and 4, we have screening rates that are north of 70%, while in wards at 7 and 8, we have screening rates that are just hovering around 50%. And that 20% gap is something that the Alliance is currently working on closing within the DC area or within DC. So the way we're doing that specifically is we've partnered recently with Unity Healthcare, and what we've done is provided them with Cologuard kits, and these Cologuard kits are intended to be used by low-income communities that are that have traditionally not done this form of screening. And in addition to that, these screening kits, or these Cologuard kits, at the time of our agreement, were not covered by DC Medicaid or DC Healthcare Alliance. So this is definitely something that is intended to really assist with those who are in those wards that have that 50% screening rate. And besides doing that outstanding work, we're also working on rolling out our big race later on this week, which is Scope It Out. It's a 5K fundraiser, and right now we've raised $221,000 out of our $300,000 goal. And if you're able and interested, please join us for this important race. The funds raised will be used to support patients, families, caregivers, and survivors. The race starts this Sunday at 8:30 a.m. at Freedom Plaza, 1325
Wow.
Pennsylvania Avenue, Northwest. So
Okay.
if you're interested in learning more about that, please feel free to get in touch with me. My contact information will be the last slide, and I would definitely love to usher you guys in to participate in this very important race. And another great thing that I would love for some of you guys to join in on is our DC Allies team. It's a team of volunteers that are comprised of caregivers, patients, loved ones of caregivers, and patients, and of course survivors. And these great individuals work together to identify potential community and medical partners interested in increasing the colorectal cancer screening rates within DC. And in addition to identifying partners, they also work towards our fundraising goals by hosting smaller fundraising events. And they also participate in outreach events, be it going to health fairs and setting up tables and engaging with those who are interested in learning more about colorectal cancer. So, excuse me. So if any of the folks that are listening are interested in getting involved, we're definitely looking to bring on more community and medical screening partners, because more assistance is definitely needed to close that gap in DC. And I'm getting ready to list out a few resources that we have here. And of course, we have our free helpline and texting and online chats. We have a clinical trial finder We have web-based navigation and online resource guide. We provide financial assistance. As I mentioned earlier, we have this outstanding buddy program that really connects those within the space to one another. We're going to be holding our AllyCon National Conference later on this year, and we really provide some very cool interactive online communities.
Kwani, there's a question in the chat about you sharing more information about the Blue Hope financial assistance, but I'm going to ask that maybe we discuss that in the roundtable update session, if you're able to stay on. I'm so thankful for this presentation. It's really, really helpful. I hope that I can share it with all the members on the call today.
Yes, you definitely can.
Okay,
And I'll make sure I send it over
great.
to you. Thank you.
Sounds great.
And
At
here's
this
my contact
moment,
information. I'm sorry. Here's my contact information for anyone that may be interested in it, and that'll also be a part of the slide. So it will be going out to each and every one of you. Thank you, Marquita.
you're so welcome, and thank you so much. At this moment, I'm going to pass the mic over to Dr. Aji Shafe from Gentech, and she's going to share with us a little bit about liver cancer screening and lung cancer screening. And I hope you all can stay on to the end and participate in our roundtable updates, where we'll be talking about more of this in detail.
Great, thank you, Marquita. And I just wanted to publicly share with everyone on the call today, she has been amazing. There were a number of cancer screening awareness initiatives that Genentech locally supported in the DC area, and she was a great partner in communicating those messages, Cancer Screening Week and our Liver Cancer Awareness Month. So I just wanted to thank Marquita for her work and everything that she does. So with that, I'll take a different approach because I know we're running on time. So my name is Sandra Ajishafe. I am what we call a healthcare director at Genentech. For those of you who are unfamiliar, Genentech is a biopharmaceutical company. We're actually based out in South San Francisco. However, about 2-3 years ago, we changed our organizational footprint, and where we have a local team that is focused on certain specific geographies and the care of patients within that geography. And so our model is really aligned to helping patients along the care treatment continuum. And that's everything from prevention and early detection all the way to survivorship. And that spans a multitude of therapeutic areas. And so I'm one of the directors on the team. I have therapeutic area managers, clinical nurses, field reimbursement managers, clinical educators, who are all under my team. And we have a geography that goes up to the Pennsylvania-Maryland border, down to Northern Virginia, and of course, covering the great District of Columbia. And so today, I wanted to just share with you some resources that we have in our alignment to our oncology sort of focus within our organization. So Kwani talked about colorectal cancer, which is another one that we prioritize, as well as breast. But specifically today, I wanted to spend some time just giving some information about liver and lung cancer. And with the two of these cancers, what we often find is that there's a little bit of a stigma that's associated with each of them, both from patients, and we also sometimes hear patients feeling that way with providers and having those conversations because it's as if something that the individual did. But with that, when you take a look at some of the risk factors that are associated with the development of both liver and lung cancer, oftentimes it's not necessarily that you are a heavy drinker in the case of liver, and or in the case of lung cancer, that it was only that you are a heavy smoker. There are other risk factors that are associated. And so I always tell people that, yes, while by training I'm a clinical pharmacist, and of course I'm on the back end thinking about treatment, I do look at patients wholly from a holistic perspective, and realizing that anything that can be done to detect early but better off even prevent is beneficial. So what I'm going to do is pull up 2 different websites and resources that we have that are actually downloadable for each of you to use within your practices and conversations with patients, and also providers can use in speaking to each of these cancer types. So bear with me a moment while I share my screen. Okay. can you all see my screen? Are you able to see my
we can
screen?
see it.
Oh,
Yes.
okay, wonderful.
Yes.
So our againstlivercancer.com website has been up now for probably over a year. It is live and it offers information about liver cancer, risk factors for liver cancer screening, and questions that patients can consider to ask their providers. This effort was done in partnership with the Global Liver Institute as well as American Liver Foundation. The resources that are here are available in both English and Spanish. And they talk about sort of the impact of liver cancer, interesting facts to know, and what you can get screened for or how you can get screened. So I'll share with you the PDF here. So liver cancer specifically is the sixth most common cancer associated with cancer death. And what we've seen since 1980 is a sharp increase in the number of liver cancers that have been diagnosed. Now, there are several risk factors that may increase the risk of someone getting liver cancer, and they're noted here. Most commonly, we know about hepatitis C or B or C, as well as cirrhosis of the liver and heavy alcohol use. But you can see there are other risk factors like obesity, type 2 diabetes, and even non-alcoholic fatty liver disease that also should be taken into consideration. From a screening and surveillance perspective, it is recommended that early diagnosis and treatment for patients ultimately is what ends up with the best outcomes for patients. And so any patient who has had hepatitis C, screening is recommended for those adults ages 18 to 79 years of age. And it recommends an ultrasound every 6 months for those patients with cirrhosis. And then there is a test, the alpha fetoprotein test, that can be done at the time of an ultrasound to also help in identifying patients early and who will benefit from improved overall survival benefits when initiated on therapy. This particular PDF that I'm showing you here is directed also for healthcare professionals. It's a two-sider and can be downloaded. And on the second side of the PDF, it has information for patients that, again, as I mentioned, is available in both English and Spanish. I also have these that I can send to offices. So if any of you are interested in me sending the glossies to you at your practices, I'd be happy to do that as well. We also have posters that you can put up in your facilities that also can talk about the information on the importance of screening for liver cancer. Similarly to what Kwani mentioned as well in regards to liver cancer, we too did some additional research in the DC area, and we found that Ward 7 and 8, where we saw higher incidence as well as mortality rates. And so we actually launched a liver cancer awareness campaign last October, which featured this same messaging on the side of buses. And we've been working locally with the health board, the Ward 8 Health Council, as well as some of the payers and providers in the area to pull through to raise the awareness and get patients screened for liver cancer. So if there are no questions here, and I know I want to be cognizant of time, I'm going to shift over to our lung cancer initiatives.
Yeah, I would say let's talk about lung cancer because we'll entertain questions.
Yeah. Okay, wonderful. All right. So with lung cancer, I think early last year, the U.S. Preventive Service Task Force changed the guidelines, what they recommended for screening. So they dropped the age to now it is from 50 to 80 years old, and then a person who smokes or who has quit within the past 15 years, as well as a person who smokes heavily. But as I mentioned, that's typically, what we see for, or what is recommended for those who have lung cancer, but it could be anyone who may have been exposed to certain chemicals or toxins. We've also learned sometimes in certain cultures, those who may have cooked over open fires, that smoke inhalation over time also makes them at risk. And so we launched this campaign in partnership with the American Cancer Society, Longevity, as well as the Go-To Fund, where it kind of sets the stage of, if you were a smoker then, this may be you now, and things to consider. So as I had shared, there's several resources similar to our Against Liver Cancer campaign as well, where it prompts patients to be able to take a screening quiz. There are resources like a banner that you can download that you want to maybe feature on your facility's websites. There's also several screening tools that are available that talks about why to get screened. It talks about the low dose CT scan, which is actually what is most recommended in identifying lung cancer early, particularly now as we're finding that 50% of patients, when they actually show up with lung cancer, they're in more advanced stages. And the idea is that if you can diagnose this earlier, better yet, even prevent it, then your treatment outcomes are significantly improved. And so there's various tools and resources available. I want to just scroll up for a second here, where you can see that it has imagery which shows like going through the scan is literally as easy as going through like an inflatable donut. I heard a thoracic oncologist describe it to me. We also talk about what it means if you don't have this low dose CT covered by your insurance. What are those options there? It also talks about one of the most important aspects of someone being screened for lung cancer is smoking cessation. So again, I'm happy to put these links to both of these sites in the chat. Stay on if there's any additional questions. Again, I can mail these resources to your practice facilities as well, or email PDFs to you. But want to make sure that because of where we've been with COVID and knowing that a number of these screenings, you know, we always hear breast and colorectal, but then these other two, which most commonly aren't discussed, definitely have been put by the side in the midst of COVID. And so with an increased awareness of whole health and prevention, it's important to look at these as you talk through breast and cancer, to also consider liver and lung, as well as cervical that I know that was mentioned, and even skin cancer. And we have resources available for all of those cancers as well. So I'll stop sharing, and Marquita, I'll turn it over to you.
Thank you so much for both of those excellent presentations. I have a question that I want to follow up on. Do you think the navigation for liver and lung cancer is different than the navigation for breast and cervical and colorectal?
And I'll be honest, with liver cancer, it's such a multidisciplinary approach, and particularly the patient funnel from where they come from. So you may get a patient coming in from primary care, you might get them coming in from gastro, you might get them coming in from hepatologists. And so because it's such a multifaceted approach, it's really important to know those risk factors that I had shown and kind of have it flagged. It's not always flagged like in our EHR systems, like some of the other like breast and colon. So it's keenly being aware of, do they have a history of hepatitis B or C, history of cirrhosis, even the fatty liver disease. I would say those are important factors to consider for a liver cancer patient. More than, and yes, there were a number there, but I would say maybe those would be the most significant. For lung, as we know, PAC years is not always well captured in EHR platforms. They're usually in notes. And so it's really having a conversation about how you ask the question to the patient and better understanding, you know, truly, have you had a history? Well, how many would you say that you packed previously, and having that consistent conversation? Because to your point, Marquita, it's challenging. It's not as easy and it's not as flagged, but we do have, you know, the U.S. Preventive Services Task Force now highlighting and recommending the need. I would say more so for lung. We're not quite there yet with liver, but we do see it more for lung now. So it's a challenge, I'll be honest. And they come in from, and I'm sorry, I went to just patient funnel wise, from a lung cancer perspective, it could be from primary care, but we also see pulmonologists as well to consider.
I wanted to see if any of the navigators on the call or referral specialists or care coordinators would have their experiences been like with navigating lung cancer screening and just the process. Can anybody speak to that?
Hello, Marquita. This is Rosa from Mary Center. We have done some. The skills I would say are the same as navigating other cancers. The difference is, as it was stated, it's the team of care that may vary. That usually includes a pulmonologist, of course, radiation, radiology. But in terms of navigation, the skills are the same because usually it is the same barriers, the stigma that exists around particular ones, and yeah, I guess I don't know if that answers the question. I know that I think it was Ina that asked, or I mean, you were asking, but the skills are the same. Barriers are very similar. It is more challenging for sure, finding resources for uninsured participants, as they're more standard screenings for breast, cervical, colorectal, but now more and more for sure there has been more around lung. So I guess that would be the other difference is just finding resources for uninsured participants. Hopefully that helps answer that question.
No, that's definitely helpful. And Dr. Audrey Shafet, you said that you were aware of some resources, correct, for uninsured patients or underinsured patients that may need to have liver or lung cancer screening, because oftentimes what happens for the patient navigators or care coordinators, we will get that referral from that provider, and it's like we then take that torch, and then we need to be able to know where we can send the patient. Sometimes it depends on the insurance, sometimes it depends on patient preference, and sometimes it just we have limited options based on whether a patient has insurance or not.
Mm-hmm. I think. And the way I look at it, specifically like for liver cancer, because it starts with an ultrasound, which, and I did my due diligence, and even from like a payer perspective, understanding like in the DC area, is that baseline minimally covered? And at least for DC Health or for DC Medicaid, yes, it is. I think as far as is more of the awareness of getting it ordered and maybe the preference of, like you said, the patient and where to get that done. For lung cancer, I will be honest, knowing where the low dose CT is can be challenging because oftentimes it's just located in one particular area. As far as coverage, I know that there's policy underway in ensuring that that's blanketly covered at least from a Medicaid perspective. But I think what we do at Genentech is that we have field reimbursement team members who sort of can connect people with the resources that they need if they have challenges with coverage, and they work with a lot of the a lot of the navigators as well as some of the reimbursement individuals at specific facilities. So I have them on my team, so I'd be happy if there's specific instances to have those connections.
Mm-hmm. Thank you. Kwani, there was a question earlier about you being able to speak to one of the programs that colorectal cancer has. Is about the Blue Hope financial assistance for uninsured patients. Can you speak to that?
Sure. So the Blue Hope Financial Assistance Program is intended for uninsured and underinsured patients. And what it does specifically is provide you with a one-time $200 check to help with daily expenses that hopefully help reduce burdens during treatment, such as household bills, childcare, transportation costs, or food. And in addition to that, our screening navigators are specialized in trying to find other forms of financial assistance that the patient may be eligible for.
Mm-hmm. I know we've been talking a lot about financial assistance, and financial assistance is very important. Do you navigators sense that to be the biggest challenge when it comes to navigating patients? Are there other things that come to light, such as fear or just low health education literacy that are challenges as well?
Hi, Marquita, this is Ina. So what I noticed, like during the pandemic, it was a lot of fear. Patient, they will hesitate to go to the hospital just because of the pandemic, so they don't want to get sick, or and they will postpone their screenings. I think at this time, the fear level is lowering, and patients, they are more they feel more safe, to go to get the screening. So we almost back on track with the pre-COVID pandemic. But definitely it always are the same barriers, kind of like transportation, financial assistance, but it's easier than before because now probably there are more resources, free services and free resources out there, such as transportation. There are so many, programs that now they offer free transportation to get patients screened. It's just easier to get access to them than before.
And this would be a good time to transfer over to our roundtable updates, and a good segue for Julia Kepnes, if she's still on, to talk about some of the transportation services that the Brim Foundation provides to meet this challenge.
I am still on, and Marquita, I'm so glad you called on me because I feel like I'm like a broken record and people are going to be bored of hearing about it. But for the new folks that are on, I'm Julia Kepnes. I am the interim CEO at the Brim Foundation, and we are a small breast cancer 501c3 exclusively focused on early detection. And the reason Marquita is tapping me is that we run 2 access programs, but one of them is a transportation program that is in partnership with Lyft and provides free rides to and from breast screening and diagnostic tests for people facing transportation barriers. And we are already partnered with lots of great folks on this call, and really leaning into expanding the program this year as screenings and diagnostics have come back online during the pandemic. It's really growing again. And we've got 8 partners in the DMV and 2 in Baltimore, and really looking to expand. So it works. It's sort of the perfect fit for a program that has active navigators on staff. Because it really, as has been mentioned earlier in this call, it's just another sort of tool in the tool belt to help get people in for their screenings. And it's quite easy. I know Rosa is on this call and Claudia is on this call. I know you probably have access to a number of different ride credits, whether it's through a Lyft or Uber Health, but we are looking to expand. And if it seems like something that could be a good fit for your patient population, we'd love to connect.
Julia, have you ever thought about expanding to like cervical cancer or a different type of cancer?
The sort of mission of Brim is very focused on breast. And so I think we'd have to be looking at a larger sort of mission expansion, and all of our education programs are focused on breast. But certainly, if we were to expand mission in lots of ways, but not for the time being.
Wishful thinking. Okay. Well, I know we had earlier when we were introducing the new members, we kind of got the ball rolling a little bit with some of the roundtable updates, but if there was anybody that wants to share what's happening with their organization, please feel free to do so at this time.
So Marquita, it's Julia Rowland again from Smith Center. To your earlier question about where do we see some of the gaps or deficits, most of the clients that we serve, most of the population we serve are post-treatment, post-diagnosis. These are not at risk for the most part. So we're treating patients, survivors living with this history. One of the big challenges district-wide is finding psychosocial support, especially for people who don't have, resources, and even people who are resourced, because often the mental health part is not covered or not well reimbursed. I don't know if other navigators are finding the same challenge. Certainly Smith Center is a great source. We offer a lot of programs. Everything we do is free. We have multiple support groups that we have running, but I just worry that we just don't have enough community resources for the mental health piece of this, which of course the pandemic has really been exacerbated.
And would you say the community resources for those that are diagnosed, not so much in the screening part, right? That part doesn't continue. Okay. I see Dion Bill put a thumbs up to that, so she agrees with you, Julia. Are there any other thoughts from today's discussion?
Really, again, I will do a shameless plug for our services because we are free. And one of the things the pandemic has given us, it's in some ways an ironic gift, is everything we do is online. So it's entirely accessible to people as long as you have access to the internet. And we, as I said, we run a number of support groups. I, in particular, run support groups for caregivers. So if you know of people who need that kind of assistance, do refer them, do send them our way. We're happy to try and support them.
Thank you for that. And I'll be sure to put that in our meeting notes.
I just wanted to share about a patient that was able to use the Lyft transportation. She didn't have transportation to go to her mammogram, to her screening mammogram, and then I coordinated the Lyft ride. And then she had an abnormal mammogram result, and needed another diagnostic exam, and she didn't have transportation. So she called me back, and then I had to coordinate the Lyft again. And then she needed a breast biopsy. And also, she also was in need of the transportation, and she didn't have enough money to pay for the breast biopsy because she is uninsured. So then I helped her apply for the Maryland, yes, that program. But thanks to that transportation, I think she was able to finally we got the biopsy results. Luckily, it was a benign condition, but she was very worried. And I think the transportation issue was something that relieved her, like all the stress she was going through during that time. So thank you for that.
And Anna, what organization are you with?
Mary Center.
Mary Center. Okay.
Anna, thanks for sharing that story.
You're welcome. Thank you.
I agree, Ina. This does show the importance of cancer navigation. Well, we want to thank you all for joining us for this call today. And I will make sure to put all this great information in our meeting notes. And feel free to continue to reach out to me if you need anything. DCPCA is always here to support you. And we believe in patient navigation wholeheartedly. I'm going to stop recording at this point.